Second, we have Dr. Rini Moses, an obstetrician, a gynecologist, and a laparoscopic surgeon. She too, like her mother, Dr. Neena Moses, is known to do maximum number of normal deliveries. She loves to educate the youth regarding menstrual health and safe sexual practices. Dr. Rini, welcome to the show. And let's start with a question round for you now. So it is said that kids should be educated about sex from quite an early age, maybe like 11 or 12 when they are pre-teens. So my first question arises out of this common parlance only, that should kids be educated or taught about sex?
If kids are taught how to eat, drink, sleep, etc., sing, why shouldn't they be taught about sex? It's imperative that our kids know about consent, good and bad touch, and they should know the safer ways of practicing sex.
Ma'am, it has been passed on from generations that sex should hurt. So, should sex really hurt?
Haven't we all heard that sex has to be pleasurable? So no, definitely not. It shouldn't hurt. Psychologically, sometimes the first few times can be painful. There can be some physical causes, like there has to be lack of arousal. There could be a vaginal infection or a penile infection, a PID, endometriosis, menopause, etc., etc.
Ma'am, can you please elaborate on sexually transmitted infections?
Sexually transmitted diseases are the diseases that you can give your partner or take from your partner. The various types of sexually transmitted diseases are HIV, HPV, herpes, chlamydia, gonorrhea. The safest way is to practice barrier method irrespective of the kind of sex you're having, vaginal, oral or anal. You need to have a barrier that you're practicing.
Doctor, please guide us on how one can have safe sex.
Educate yourself before indulging in sex. So take knowledge about it from your gynecologist. Vaccinate yourself from the HPV virus. Carry your own protection like condoms and dental dams, and refrain from doing things that you do not know about.
Ma'am, what are vaginal discharges?
Vaginal discharges are normal because the area needs a lot of lubrication for a smooth ride. So unless and until it's foul smelling or it's itching, vaginal discharge is considered to be normal.
So doctor, does masturbating during the periods helps?
Masturbation during your periods does help with your mood swings and abdominal cramps, though it's a little you with all the bleeding, but yes, you can.
Doctor, let's have a rapid fire from these questions on. Period sex, yes or no?
Yes, you can have period sex, but always with a condom. Always, always, always.
Doctor, oral sex, yes or no?
Yes, you can have oral sex. Men, please use your condoms. Women, please use your dental dams. And it's after all your choice.
Ma'am, anal sex, yes or no?
Anal sex is a choice for you and your partner. So if both of you are in agreement to it, definitely yes. But please use a condom. Please do not use the same condom later on for the vaginal or oral sex if you were practicing it. Third thing is lube is very necessary.
Ma'am, this would be the final question from you. What are the things that we should need to keep away from our vaginas?
Things that you should keep away from your vagina are douches, scented suppository or lubricants, a naked penis unless you're planning a pregnancy.
Thank you so much, Dr. Rini, for sparing your valuable time and guiding all our viewers regarding the most important topic of everybody's life, that's about sexual health. Thank you once again for your knowledge sharing and your patience with us.
Nikita, thank you for having me on the Doctor's Dictionary.
Thank you so much, Dr. Neena and Dr. Rini. It was a very insightful session with both of you. Hopefully, आप दोनों को भी आके बहुत अच्छा लगा होगा.
Yes, definitely.
So this is the wrap from the Doctor's Dictionary for this particular episode on menstrual health and sexual hygiene. Thank you.